And then here we go. Mm-hmm. Share on your page.
Oh, oh. Oh.
Okay, I think we're going live.
Yeah. I'll drop on Facebook too to see. They're doing good.
Oh,
Yep. Meeting is now streaming live on Facebook.
it says that here, but not on the Facebook. So let's give it another shot.
Oh, I see us.
Okay, cool. Let's just go then because it says, anyways.
It says
Hi.
live. We're good.
Perfect. Perfect. Hi, everyone. We are here for our um June Pink Table Talk. I'm here with two really great friends, my co-host and another great friend in this work. I'll let them introduce themselves.
Hi everyone, I'm Dr. Candace Thompson. I'm one of the breast surgical oncologists in the Bay Area and co-host of Pink Table Talk, and really excited to celebrate Pride Month today and talk about the LGBTQ plus community.
Awesome. And we have
And I'm Nia Bailey. I'm a radiation therapist, president of Bird Cancer Foundation. Huge fan of Haley and Dr. Candace. And of course, I got to represent Philadelphia 76ers because that's where I'm from.
cute, 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 even though I will say I am a Knicks household. So good. Yeah, I know. I
All
know.
right, now. Happy
I know.
Pride.
I
Let's
know.
talk about something good right now.
Right, right. No,
But
but
you
it's
have
been
to
a
be
fun month.
excited for the Knicks.
Yeah,
Like,
Right. I'm
it's
not a
been
Knicks
like
hater.
over like
totally.
50 years.
Right, right. So no, it's been an exciting month, right? There's a lot to celebrate this month. And Pride is one of my favorite things to celebrate. So I want to have that conversation, but also want to share what's happening recently in my life because I feel like these moments are about Black women's health, right? Like that's why we're here
Yeah.
to have these conversations. Specifically, again, we this is for this Pink Table Talk goes to the LMG campaign, all about um, Black women and Black breast health and how we take care of our girls. Um, and so uh so first, let's I'll first do the family piece and then we'll dive into Pride. Um, so those of you who know my mom, she is the Touch CEO and co-founder. She yesterday was at started her day at the Lynx conference in Detroit, and then somehow managed to fly home with really, really bad stomach pain. It came on Friday night, and then landed here, went straight to the ER. That's when I was alerted, so I got in the car and met her at Anne Arundel Hospital. And she was in like excruciating pain, right? The ER was a zoo, mind you, like a lot of people there, and I get it, it's busy. And so, after about she had already been there for maybe, an hour. So after me joining her for another hour, making it two, I was kind of just like, maybe I'll just try to go to urgent care, right? And get an appointment somewhere. So made an urgent care appointment and went there. And, my mom had just got back from traveling abroad and like she definitely does too much. And so and she can totally probably hear me. But oh, here is Whitney as well. Um, Let me admit her. So hello, hello. Thank you for joining us. There she
Hi
is.
there. Hey,
Hi,
ladies.
hi.
Happy Sunday.
Happy Sunday, happy Pride. So Whitney, I was just sharing this crazy story, my last 24 hours. So my mom was in excruciating pain. We go to
Oh, no.
urgent care, and there we're at least able to do a urine sample. rule out like UTI kidney situation. So then we had to still go back to the emergency room though, because they're like, you need an ultrasound. It was an acute pain, lower right abdomen, like just excruciating. And I've never seen my mom cry.
wow.
I like, she doesn't cry, she doesn't wail, she's on the floor, like
Oh,
crying.
shit.
And we are in the emergency room and we were there for probably another 4 hours.
Oh, wow. She just
Um,
They
hurt.
didn't emergent, like they didn't do a CT scan immediately.
So they didn't. I even lied at one point and said like she's getting chest pain, so they would give her an EKG or something. Like my friend texted me that she saw that on Grays, so we tried it. And so then they pull her back for the EKG, then spit her back out, and it just got to the point where I'm now like getting
Yeah.
irritable, like I'm now starting to turn up a little bit. And they had triage, done blood work, so by the time she did go back, like things would be a thing. But it got to the point where they were like, yeah, you've been here the longest. And yet still, and I think too, it was hard because there's so many people in this room. So I get that they're busy, but
Right.
it was really hard because I was like, although I don't know how everyone's feeling in this room, she is the only one visibly crying and on the ground. Like,
Yeah.
how are we tolerating her pain? And I think a part of the dismissal that we were experiencing was because she didn't have a fever and her blood pressure was high, but like not to the point of, I guess,
But
doing
that
something
doesn't matter.
bigger.
Did she have like a white count? Like
No,
it
and
wasn't
even
elevated?
but they didn't even do that. And so
Wow.
even the triage that we got at the urgent care, they like faxed over information and gave me paperwork about like she needs an ultrasound now, and that still didn't even get us in the door. Honestly, I think what did was we called a family friend who's a nurse who ended up like calling the hospital and getting us a room. Like I don't even know, had
Wow.
we not pulled a card, had we like
And
we
she
would
would have
have,
had ruptured appendicitis.
you know what I'm
Grandparents.
saying? And so, and to the point of it was starting, they called it perforated, right? So there
Right.
was some leakage around it. And it does beg the question, had we not been waiting for 8 hours, like would it even be perforated, right? Like would we
Right.
even be here? And so, by 8, we finally got to a room. By 9, she got morphine and Zofran to like just deal with the pain. And so she was a little bit more settled. By 11, CT scan, and by 1, she was headed to the emergency room. But like it was a long day.
Jeez, dude.
And I think it was, we do this work with Black women and we talk about the dismissal and the pain and all the things. And it's like to even experience that with the knowledge that we do have. And
Right.
again, we had a friend to call. What if we didn't? And like who else, like the people don't have that friend to call. And so it just reminded me about this work that we do
Right.
and how intense. And like just so we're home now, she's good. The surgery went really well. They were able to like do the least invasive option, which is great. But it's interesting because also on Friday, this is getting very personal, so thank you guys for being on this journey with me today. Even on Friday, we decided to do hospice for my 93-year-old grandmother.
Oh, sorry.
And so, yeah. And again, like, I think that we're all in a good space around that. Like, she's uncomfortable and we don't like this anymore. Right. And she's lived the best life. And like, hospice doesn't mean it. Like, she could be chilling, but like, give her the good drugs, give her the Xanax, whatever, like, let her chill, But this is a time in my family when I really need to trust the medical system because there's so many different things happening. So it's really hard that it feels like I can't,
Mhm.
and it's like, it's like that's what's so hard about the mistrust in this space because we like have to trust these things. Like there was nothing I could do for my mom to make her feel better yesterday, right? I had to wait. I had to
Yeah.
be a part of this journey. So it's an interesting thing right now because I'm just like, I have to be able to trust this. I have to, I have to know that grandma's going to get the good care. I have to know that my mom and so it feels really intense because I'm just like, how do I play a part in this? And who do I even yell at? Because it's like
Right.
the doc, like they, the surgeon didn't know that she was outside, right? And it's like, how do
Right.
we, it's like, I don't even know who to get mad at right now, but I'm like frustrated in this way, but I don't even know who to take it out on, right? Because I
Everybody
saw,
in their
you know what I
family.
mean? And so anyways, that's what's going on. And so I like, we will talk about pride, but I just want to get like even your responses to that. Because Dr. Candace, it was like, what is that routine? Like, what should have gone down?
Right.
Well, I mean, so as breast surgeons, we spend the first 5 to 7 years of our training doing general surgery, and I can do a lap appy in my sleep, a laparoscopic appendectomy. And we don't know who's in the waiting room necessarily. Um, so we, until the emergency room doctor calls us, like we were not really aware of things. And sometimes there can be a delay with working people up. And I've seen it even in training, like we'll sometimes like look at the emergency room board and see who we think is a surgery candidate. And sometimes we'll preemptively go down there and be like, let's just go see this person now, because it can take a long time to get out of the waiting room. I would say to like anyone in that situation to there is patient advocacy who you can reach out with, like even while you're in the waiting room, to just be like, this is not okay. Um, and if you do have like a family friend who's in the medical field, like you did, Haley, like you can reach out to them. Unfortunately, sometimes that is what it takes. The system is not perfect. And but I would say just mostly like patient advocacy and basically advocating for your loved ones while you're there, like you did. Um, it's unfortunate that that happened. Time is of the essence with appendicitis, so
That's what it like.
I
That's what
mean,
we all. I watched Madeline and read like that was like my and so like I feel like it felt so emergent and urgent for my mom to be
Right.
seen, but it's like that's what I know
yeah,
about an appendectomy. Also know that it is a routine procedure and it is this thing that like could be done and
yeah.
done with so easily, like, and so it was interesting to be in that
Also,
space.
though, like the time the antibiotics is extremely important too. So that's
Yeah,
why I was asking about the white blood cell count. Like someone comes in with right lower quadrant abdominal pain, the first thing that anyone should be ruling out is appendicitis unless they don't have an appendix anymore.
exactly.
I mean, there are a few other things, like there are some gynecological things that could happen, like ovarian torsion. I won't go through the differential with you, but like the most common thing is appendicitis. So,
Exactly. As soon
And
as you said the area, I was like, appendix,
exactly,
get it
right? Like,
out.
and I
yeah,
think too, what was interesting about it, and the part where I'm like, is this like a Black woman thing? Like, because I like sometimes you
Right.
want to just jump straight to that, right? Because I see the people waiting in the room, and I like don't want to just. But then the part that really got me was she didn't have a fever, and her blood pressure was rising, but not to the point of it like someone
but
needing to
those
like
aren't like necessarily like
exactly, but like it felt like those were the markers that they used to say that she wasn't a priority.
if someone is in
Mhm.
severe pain crying, that's a priority.
Right.
Totally, right? And
Right.
so it just felt like if she did have those signs, right, that like were on the list that I think that they were checking off, had they have like and do symptoms, as we know in breast cancer, like symptoms look different, side effects look different. Like, was her body just reacting differently to this thing, and so that there was pain and not these other factors, and so they like just didn't think it was as emergent, and so again, like it just makes you question all of those things because it's like, how
Yeah.
does a ruptured um appendix come out at age 70 for a Black woman?
Right.
Like, what are all the factors that lead to this? And like the medicine that she takes are like every day already that lowers her blood pressure. Therefore, like that's still acting, you know? And like, anyway, so again, it was just interesting. I feel like activated in this work even more so because of my recent experience. And then also just like a little lost though about like how to do this thing.
Right. Right. I was thinking too, like who do you or like where do you go after kind of like everything is cool, like as far as a family member goes, like where should people be guided in the sense to like let me start, not even just a complaint, but just who should I automatically gets information just in case, or where to do, you know what I mean? I don't know if I'm saying it right, but um, is that something that we should start like having people do just in case so we can spread the word in the community to be like, hey, if you experience something, this is where you go. Because I mean, I feel like I wouldn't know where to go after that. Like, who do I call to complain? Do I go search the internet or do this? Or is there somebody
Oh,
right then and there I could talk to?
and
Well,
where,
you
like
go
you
to
said,
the
patient
hospitals.
advocacy. Yeah,
Yeah,
where do
the
you find
hospital's
them?
website, if like whichever hospital you're at, if you go to their website, they and search like patient advocacy, then it'll normally just pop up,
Okay.
Perfect.
and you reach out to them.
That's what I
No,
did with
that's
my
good to
dad.
know.
I did the same thing. He was in a compromising situation in the hospital. I looked up blank hospital CEO. It gave me patient advocacy, like Dr. Candace said. I called them and sent them an email at the same time. And within 30, 45 minutes, I got a phone call and they came down and met me. And I was basically like, I'm from West Philly. I was like, I will blow everything up. So my father's like, what are we going to do here? And so we ended up meeting with the VP, the medical, somebody like medical BP, just all these people in a team, and they ended up getting, my father the care that he needed. But yeah, to everything that Dr. Candace said, and to Whitney, what you're saying, even Haley, like you just gotta yell from the mountaintops.
Yeah, it's
Sometimes
Yeah.
just so
you
crazy because it was like I also like avoid confrontation in life. Like I'm not that person who like wants to make a scene in certain places. And so it was as I like am increasingly making a scene, I'm just like, this is not even my normal. Like it just all felt kind of gross in that way. And I didn't even mention like my sister she's like 8 months pregnant, right? So again, my family's in a place where we like really have to trust the healthcare system, you
Yeah.
know, especially being, I guess, in this sandwich generation, right? It's like, how do I care for everybody, myself included, and like find places that I trust? And I was like, guys, we messed up that like none of us became doctors. Like good thing we have some people, but like, you know what I'm saying? Like somebody should have done that. Just like and I'm just like, we need to have a lawyer, a doctor, you need to have all these things in your arsenal, or else you like
At
what would
risk.
I have done? Because when we got back, they came and were like, oh, we're so sorry. Jerry called, like, like our family friend got us in the room, and it was like, what if she hadn't called?
Right.
Like I
Yeah.
don't know.
Scary.
Yeah, I'm sorry that happened. It's very unfortunate. And like if there are any sequela that happen after that, then I would definitely reach out regardless. But
Oh, well, Ricky's about to be all up on the LinkedIn and like she's about to, like you should have seen when they change her recipe at Starbucks. You know what I'm saying? Like she
I
she's
love that.
about to go in, you know what I mean? So like they should be ready. And they're not ready. But yeah, no, it's just interesting. Again, like, Black women's health is something to always keep in like to think about. Um, the other side of the coin is that um, my mom may have needed this reminder to slow down a little bit,
yeah.
and I hate that this is how far it got. I know that's how she even viewed her breast cancer, as something that like would encourage her to do that, right? And so, but this is another one of those things that I think is a sign. Given that she was in Kenya last week, I'm really glad this happened here, just because I'd be on a
Yeah.
flight to Kenya. If not, like I don't know what we'd be doing. And so, because I do want to see the other side of this, and be thankful for the version of this that we did experience. Um, and yeah, but again, it's like it's tricky, and just to bring it even back to our Pride Month moment, because I do want to refocus us here, is like that mistrust in the
Yeah.
medical world must be something I can't even imagine. um yeah, just like the thing that we like look for to find doctors that look like us and different things like have our similar experience, like that's even more unlikely in the LGBTQ world, right? To like find that. And so, on that note, what are you guys doing to celebrate Pride? Let's start personally. What are you doing? And what does Pride mean to you? And I'll even give my example of like I taught elementary school before this work. And I taught elementary school in the Bay for years. And so like it was like a little bit more like of a thing to celebrate Pride. But I moved to DC. I was like, what do we do for Pride at this school? And they like kind of didn't. And I was like, what? And so and I asked my principal, I was like, oh, we're gonna do this, right? And she was like, you need to get parent permission, like blah, 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 blah. And I was kind of just like, Okay. And so, anyways, it just turned out that I was going to talk with my kids about like what we're prideful of, right? And we did little acrostic poems. We did take rainbow chalk and like chalk the like this teacher parking lot, of course, with all of our things and like read our poems and things like that. But it was just about being prideful, right? And all the things that make us feel good about ourselves. So like that's kind of how I love to like think about pride in a way, I guess the things that make me feel prideful. But in general, I was supposed to be at Harlem Pride in New York yesterday. And it was raining. And so they even emailed me being like, we're okay if you decide not to come, we'll give you your money back. And then you do the thing. And it was like, you can either get your money back or donate. So of course, we like donated my thing, but just said I wasn't coming. And thank goodness I wasn't in New York this weekend.
Right.
But on that note, we do love to do Pride. We usually table and do something. And so it's always fun in the touch world because like everybody has breast tissue. And so I feel like it's really important to take care of it. Like, does it really matter who you are, what you're doing? You got some breast tissue. And
Mhm.
so that's how I like to think about this. So yeah, what are you guys doing for Pride? Personally, professionally, all the things.
I've been outside and emailing, texting people, Happy Pride, just like I get Happy Black History Month, just like I get Happy Women's Month, and just making sure that people, like, I always ground it like we're all God's children. And so I just want you to make sure that you are loved no matter how you identify, what you look like all those things. Um, and so I just been outside. I recently tabled at the Philadelphia Convention Center, and I had opportunity to meet with a dope gay man. And he looked at my Instagram, and he was like, "You love Jesus," and he like kind of paused.
Oh.
And he was like, "Tell me about that," because with religion and the community is like sometimes it bashes heads. And I said, "I love you. I don't care what you got going on." I said, "Just like you don't care what. Listen, we all people." And it was just a beautiful moment of like, we're God's people. Love is love. And so I just been outside, loving on people and telling everybody I see Happy Pride.
I love it.
I love it.
I love it. I love it. Well, myself, I'm here in California. I live in West Hollywood, which is like always celebrating Pride. We have a really, really rich, beautiful community of people. For myself, I did turn up with some friends at the West Hollywood Parade, which is my favorite. And they like bring out like I think Lizzo performed, and like they always have a really, really awesome activation. So I went outside and allied with my people. I have a G hub, a gay husband. So I love to love on him and everybody else that's in our little family, if you will. And then with the organization that I'm a part of, or just like professionally, it's the same thing, making sure that the girls that I mentor or anywhere that I'm at speaking understand that exactly like you said, love is love, and we do what we need to do. And I just want to make sure everybody's as comfortable around me as possible and know that they're supported in any space or place or however they want to identify. So happy Pride to everybody. And I'm excited to be a part of just, like I said, as an ally, I'm in the community. I don't know if they need to put that's what the I is for me. It's like, you know. I'm in there. I am in there with you guys, regardless of whatever it is I choose to be a part of. So that is me in celebrating Pride.
I love that.
Love it.
I guess pretty much the same. I'm just out in the community. I live in Oakland, and my solid core studio in the Castro is very prideful. There was like a drag, like pride, um, Pilates day. And I feel like pride to me is just inclusion and accepting. I think we need more of that in the world. It doesn't really matter, like Dr. Nia said, it doesn't matter what else is going on, like what they have going on there. Like I feel like I'm an ally. I support you however needs to be supported, and especially as a surgeon, um, honestly, the sexual orientation, I guess, to some people matter, but I'm still just treating the entire human. So, It doesn't matter what part of the LGBTQ community that you are. Like, I'm here to help and to make sure that you're being screened. And if you had a mastectomy, making sure that all of the breast tissue was removed. So yeah, I think it's just inclusion and awareness to me, and making sure that people feel comfortable speaking up about health issues and not being ashamed of things that are going on.
Well, it's interesting too, because like I saw this some Instagram video about like a teacher talking about race in a way of like cracking a white egg and cracking a brown egg and being like, guys, look, there's the same egg on the inside. So I imagine as a surgeon, you're just like, I'm dealing with the same organ. Like once I crack you
Yeah,
open, you know what I mean? Everyone's got this,
exactly.
like it's like you just, you guys got to do the work anyways. So that's how I imagine what it's like when you crack it open a body, you pull out the template. Um,
Yeah.
but but no, I think that this is really important. And I like it seems so interesting to me that like the work that we do in breast health, it feels really gendered at times, right? Because it's just like it just, I feel like breast cancer advocacy groups are so interesting because it's like so many women. So it's like girl fights over here, cattiness. It's like sometimes it gets really petty. But also I think there's a lot of activity in breast health because there's so many advocacy groups. Like there's a lot of activity in this space, which is really, really cool. Because
Yeah.
like women get shit done. That is like what they're gonna do, which is the cool part. But it is like breast health does feel gendered and does feel like it should be a conversation in all communities. And so like, how do we do that? How do we make it a thing that like we can talk about breast health everywhere, and like that understanding of taking care of our girls? Because what we do at LMG is like everyone has girls to take care of, whether they're on your body, your friend's body, your mom's body, like whoever's body they're on, we all got girls to like think about. And so it's like, again, like how do we bridge that gap in a space that does feel really gendered and like pink and like all, there's so many reasons why it feels gendered, but like how do we do this?
Just talk about it. I feel like we make things too complicated. Just talk about it. Like my uncle passed away of breast cancer, and he was from the South, and that was something like he was a tall black man. I got breast cancer, like what? But Narda was like, my mom, you better talk about it because this is something that we need to talk about. And it's so funny, even when Bexa comes to our events that Touch always sponsors. Um, Sometimes we have to say breast and chest, and it's so like crazy because if we just said breast, there were so many men that were like, oh, I don't need that. I can't get breast cancer. And they're
Yeah.
like, well, if you said chest, then I know that it's for me. And it's like, listen, we all have breast tissue. Maybe ours are more pronounced than yours, but we all got something going on. So I think if we just stop making it difficult, just have that conversation. You need to check your breasts too. And I think that's sort of how we like bridge that gap and sort of stop the confusion around the conversation.
Yeah, I love that you brought that up because I was just thinking like men get breast cancer too. It's not as common. It's like less than 1% of men. But I mean, black men are at higher risk of like triple negative breast cancer as well. And I think there was some awareness with it with Beyonce because like both her mom and her dad had breast cancer.
Wow.
Um, but yeah, I think just talk about it. As like Nia said, for men, you still have breast tissue for the most part. It's just a lot less pronounced. And unfortunately for men, they will come in with more advanced cases of breast
That's what I was
cancer.
gonna guess.
Yeah, I had two male patients last year, which no, most people have like 0 to 1. I had two. One came in and his whole arm was like twice the size of the other arm, and he had
Oh my
breast cancer that
God.
had already spread to his lymph
Oh,
nodes
wow.
because he didn't even know what to look for. And ironically, I just treated his wife for breast cancer, and then I ended up treating him. But like men, you should be aware that you can get breast cancer as well, especially if you are like taking hormones or anything like that, sort of going from like male to female. That can also increase your risk. So that's something to definitely be aware of, especially for our transgender male to female patients too.
Is that not what does that look like, female to male? Is that different?
Female to male is so they would be the ones getting the mastectomies. So
Yeah.
whenever you're going to see someone to do top surgery, which is essentially a mastectomy, you need to make sure that you talk with them about how much breast tissue they are removing. Because a lot of the aesthetic or cosmetic or plastic surgeons who do the top surgery, they're not necessarily they're not surgical oncologists. They don't train specifically in breast surgical oncology. They train in plastic surgery or aesthetic surgery. So their main goal is to make the former breasts look closer to a male chest. And if you sort of look at the two side by side for men, like they have like some fullness still, especially like um, medially. So there will be some breast tissue that people leave on purpose in order to have an
Mm,
aesthetic looking male chest, which means you still have breast tissue there, which means you're still at risk for breast cancer. And you potentially could need screening depending on how much breast tissue is left behind. As
mm,
breast surgical oncologists, we typically will try to remove 99% of breast tissue. So there's a very, very thin layer of fatty tissue that's left behind typically. But for these aesthetic procedures where people are having top surgery to go from female to male, then there can be more breast tissue left behind than just less than 1%. There can be like 10%, 20%. Just this week, I went back for someone who reportedly had a mastectomy, and I removed enough breast tissue to fill a B cup.
Wow.
So, and she had a recurrence because there was so much breast tissue there. I didn't do the first surgery, but it is possible to have a mastectomy and still have breast tissue left behind. So you
That's
need to
like
be aware of that.
Right.
great information. Wow.
I wonder too, just the topic of the mastectomy, but when it comes to the top surgeries, I wonder if that's part of like, do they screen them just in case? Because again, I feel like in a case where they might just take it off because they want aesthetically to look like a chest, what if they leave some, some of the bad stuff in there and then it's like a whole bunch of mess later on. I wonder if that is, and I know maybe you all
So
might have information on that, but it's curious after hearing what we were talking about.
yeah, so they're chronically underscreened because so people don't know that like there's still some breast tissue left there. So that's something to like talk about with your surgeon who's doing the top surgery and like how much breast tissue is left there. Because if there's still breast tissue there, you should be screened.
yeah. Well, I think that's interesting too, because it's like you said, that person might be having more conversations with a plastic surgeon versus a breast surgeon like yourself, right? And so that makes that really interesting because, and I think that my one of my best friends, like most of you guys know, my best friend Brianna, but she did like a plastics rotation over the summer a couple months ago. She's in med school now. Um, but it was really eye-opening to be in a space for her to learn about, because sometimes you think of plastics, you think of like vanity and like, I'm doing this to like, but it's like, what does it do for your mental state to feel good on your in your physical space in your physical state? Like what does it do for you all around to like be who you are? Like, and so I feel like she had a new respect for plastics because she got to like giving someone their hand back or like, just like certain things are like really, really powerful. And so I feel like that's a really fun space to be in because of that.
Mhm.
With that said, that person might not like be as alert about like you should still be getting screened or you should still be doing this, right? Because like might be focused on again giving you this thing that's going to make you feel better. And so I think even having all of those consults, right, and having all of those conversations with your doctors, the full team about what this organ is or what this thing does, outside of just how it looks and feels to me, and making sure you get all the different versions of the story so you can make good decisions and right decisions, right? Because it's like, um, because it's got to be tricky to like navigate that, because again, you might not feel safe at the doctor's office, and you might like not even go, and depending on where you live, that
Yeah.
looks really different right now, right? And so like I've had a lot of conversations with people in Texas who are like dealing with health really differently now, because of where we are in the world. And so yeah, I just think it's interesting, and I hope that um people know that like we're down to talk about it. Come talk to us. Come talk to Dr. Candace. You know what I mean? Come to these advocacy organizations and like be a part of the conversation, because whenever I'm asked a question that I just don't know, it's like, oh, I'm gonna go figure that out. I'm like, I text Dr. Mo all the time to be like, hey, like what's going on here, and so and even yesterday I talked to like doctor friends about my mom. I was like, what, like how long we got before like what we got, like, and so I feel like the more we can do to just make it casual and like okay to talk about things is, I think you're right, Nia, about that, because it's not always easy, but it gets easier as more health stuff goes on. Like in my family, I'm like, it gets a little bit easier to talk about, So I feel like the more you open that door, like there was a day probably when I would have felt like ashamed about saying like I had diarrhea for whatever reason, right? I'm like, like I remember like maybe in high school I was like I didn't want to say that out loud all the time, but now it's like, oh, what's going on? Like, or just it feels so much more casual to talk about health stuff. And so I do think the more we open that door, right, the better.
I
Yeah,
do have
I think it's, oh, sorry, you can go.
No, I was just going to say, Dr. Candace, to your point, like, would you ever teach the plastic surgeons to say, like, hey, you may be doing this because of aesthetics, but make sure to inform your patients that they do need screening because you are leaving breast
Right.
tissue. Is that ever a thing in?
Well, I mean, they know that. The
Okay.
question is whether or not they're actually like talking with their patients about it. That's the real question. I mean, they went to med school just like me, and they did residency just like me. I did it alongside them. Like, they know this. Some places actually have it where like the breast surgical oncologist does the mastectomy, and then the plastic surgeon will do like the reconstruction to make things look like a male chest. So some places do it that way. Some plastic or reconstructive surgeons do it all on their own. But if you're going through that, you should also feel empowered to talk with them about this frankly, so that you know for your future as well.
Mhm.
Because I have had a few patients who have had top surgery, female to male, and I've had to go back and clean things out. So it
Yeah.
happens. It's not infrequent, just so that they aren't at risk anymore of
Right.
getting breast cancer, and so that they won't have to get screening. Because after a mastectomy, technically, you shouldn't have to get screening.
Um,
So, in other words, go to Dr. Candace first so you don't have to
right.
get it done two, three, four, 5 times.
Right. Right.
And if
Thank
you
you.
don't have the resource like Haley to talk to doctor, if you don't have the resource like us to text Dr. Candace or text Dr. Mo, you can contact us. This is the point of Touch the Love of
Mm-hmm.
My Girls, that sometimes you don't have that resource, but these four women on the screen can help you. And if we don't know, we're going to find somebody to help you. So you do have that resource with us.
Yeah.
Yes.
And I know it can be difficult, especially with the LGBTQIA community, to find doctors that you trust,
Right.
and that you feel like understand what you're going through. Sometimes it does take multiple different opinions. I mean, this is your body. Like, you wouldn't go like buy the first car that you see. So I would say to feel empowered to like take the time and go through like and visit with different surgeons until you feel comfortable.
I love
Yeah. Yeah, and then talking. I feel like I love having these chats, right? Whether it's two of us or 17 of us on these calls. I think it's just I learn something new every call we take. But then that's the same thing with just sitting around at your house with your homegirls or your friends who are part of the community. Just talk about the stuff that you've got going on, Haley. Like you're like, oh yeah, I had a crazy bowel movement the other day, and that could start to have a conversation to the
Totally.
point where we start now, we're talking about breast tissue, so just, the more comfortable we are with even just opening up and talking about just anything medical, I think can just help continue to save lives and educate us to share. So talk, 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 talk.
And I
Yeah.
think it all starts at like home too, because I know, Haley, you said you were like uncomfortable talking about diarrhea,
I
but
think
it
I can remember a day, when I just
yeah.
wasn't like openly sharing that.
And I was like the opposite growing up.
You
Like
were?
I would just
But I said, this
tell
is why you're a
pretty
doctor. Be like, guys,
Right.
some weird's going on. I got you
Oh
want
my
to
God.
figure it out then.
I'd
Oh
be like,
yeah.
this poop looks weird. Like go into detail about it.
I
So,
was
but
I
this
was
started
saying,
like early on.
I
no,
know
I think
I can see you doing this now. Like
that's
this
so
makes
funny.
sense. This
But
totally
like
tracks.
talking with like your parents and stuff about it, or talking with your children about it, I guess, because my parents would talk about it. So it really starts there so that like you actually feel comfortable in the future and like raising kids that are comfortable talking about their health.
That's
Right.
cool.
That reminded me too of like, I have two older brothers, so I was the little sister, and they're like taking photos of their bowel movements and like sharing it like as a joke and as funny and this and the third.
Yeah.
And then as I got older, because I'm around just these boys, right, who are doing that, my friends who's a nurse, I'm like, is this weird? And I'm like, if our DMs ever get leaked, they're gonna be, these ladies are
That's
crazy.
hilarious.
But we're safe. And
Yeah.
I'm like, hey, do I need to go to the doctor? I'll just straight up, I'm not going to explain the code. I mean, I'll tell you, but I could show you better. And
Right.
it's not a thing. So I think it's cool to as us girls, like society kind of tells us you're a nasty little girl if you do stuff like that or talk about poop or this and that. You're a human. We're all doing it. Just like the breast tissue. We all got those BMs too that are really great indicators for what's going on inside your body. So get more comfortable with talking about the dookie.
Right? No, totally.
That's
And no, my dad always called them bowel movements, like
Yeah.
saying like poop was like not appropriate, like bowel movements was the word. And it was like,
Yeah.
okay. And he was like talking about it, but like had to be like scientific and structured in this way, which is funny. But yeah, no, I feel like, and just thinking about love of my girls and how we want to like talk about things even younger, and you think
Yeah.
about like, you know, the coming out experience and how like that really varies by age based on like comfortability as well. And so like how hard it must be to like it's a whole nother thing after already like having to have some of those hard conversations. But I think about Nia first. I don't know if I've like fully thanked you for this, but Nia got me to be a part of the CancerCon conference a couple of weeks ago, and we were in Seattle for that, and it was really cool because I I in breast health, right? In my world, like young is still post puberty. Whereas at this conference, these were like pediatric cancer cases and like even younger, right? And so it made some of those health conversations that you have to have with your family like so much younger for these families, right? And so it was just really eye-opening to be in that room and be in that space because again, and I feel like there was a lot of non-binary in that room. There was a lot of like different people with different walks of life, but like all coming together of this common thing about like I almost died at this point in my life.
Mm.
And so it was just really interesting and an eye-opening moment. Nia led a really great session, and I met Cheeky Charity, this amazing like organization that has like they have like really awesome like rainbow ass heart stickers. It was like great because it's like colon and anal cancers and like that kind of awareness, and so it was like really really great. I'm obviously rocking many of the stickers, but again I just felt like again, how do we have all these conversations earlier? How do we have all these
Right.
conversations and be inclusive earlier? How do you learn to like the thing that like at one point you feels like an other isn't, right? And like who cares? And so I feel like the more that we can like teach and like and have these younger conversations, the better. And I think it's cool to be like in our age range right now because we can talk to both generations, those both older and younger than us, and having that power to facilitate these conversations so multi-generationally, you know.
It's the same thing like Dr. Candace said, like just talk about it early on. Like my mom, I knew what a period was probably when I was 5. So when I finally got it at 12, I was like, oh, I have my period, just having
Right.
that conversation, taking the sting out of it, and even just learn like, mom, my nieces will say to my mom, somebody's pronouns they, them. She's like, okay, like not make it, okay. So that's what the pronoun is. It's not like it's not that serious. You want to be called this is what you're called. And I think it's the conversation at home. It's that safe space. It's that
Yeah.
we all want to show up how we are. We want to be accepted. So why is it any different for anybody else? So
Right.
it's that conversation at home, just, and no matter what, and there's age appropriate ways, I think I knew about sex early on. It's not like my mom was like Meganese, but she said this is what happens. And that way, as I grew up, I'm like, oh, that makes sense. And one great thing was like, it wasn't boobies, it was breast. It wasn't this, it was penis. It was that, you know what I mean? So I knew the
Yeah.
words, what they were. And of course, as I got older, I would say boobies or whatever, but she didn't, like, I wasn't fearful of anything. It's like, this what it
Right.
is. This is what happens. Accept people, love people. It's not that serious. I think
Yes.
that's what we just need to do. And I think that's why to the pride connection, I always bring a support person, like how you were with your mom. Like I had a patient, I'm going to say John. My pronouns are they, them. Okay. And some people would say like, well, he, she, you can't hear. Do you
No,
understand
that's the
English?
worst.
They, them. And so it's also us being in that space and being their advocate, being the allies, like
Right.
what you said, like, yo, this is what it is. Like, it's not that serious. And now
Right.
I'm the big sister. Like, you want to make sure you say the right thing. So, just not making things that difficult, always advocating, always being the ally, and just being that safe space.
Yes.
Yeah. I feel like we also probably are speaking from a place of privilege being in
Totally.
like larger cities,
That's right.
Yeah.
because there are a lot of people in the community who live in middle America
Yeah.
where they're not as progressive and there's still a lot of shame and stigma around just being themselves,
Yeah.
much less going in for like a screening for breast cancer and and maybe they're trans. Like there's just so many other things. So we're here for you if that's the
Mhm.
case. And there are still people out there. It just may take a little bit more time to find someone. I know time is money and valuable, but time is also important because if we do catch something earlier, then that's the difference between life and death sometimes. So
Right.
it's really important. I know like it can be shameful or stigmatizing to go to certain places, but there like you may have to drive a little farther to find some place where you feel more accepted. But I think that's very important to do in order to make sure that you're taking care of your health.
Yeah,
Yes.
no, we actually, one of our great partners in this work is Know Your Lemons. I feel like those resources are just like they're brilliant because of their inclusivity inherently, right? Because it's like it desexualizes the breast, like for so many reasons they're great, right? But also like the anatomy is similar and then it matches for again. Check out Know Your Lemons if you're looking for breast health resources. We actually worked with them to make like a Black version of the app. And so if you do identify that way, like you can put that setting on and instead of having I think they have like Napoleon or Mona Lisa like guide you through it. The Black version has a fairy godmother. And like so we like worked really intensely about how to make that experience match. But again, I think if you're looking for resources on like how to take care of your breasts and do that, then please by all means like download that app. Because the other thing that I think is really notable here for anyone who is experiencing hardship finding good doctors, going to
Right.
the doctor, going over that leap, you need to know that like 80% of abnormalities in breast cancer are found by doing self exams. Like, do your self exams every month, make that a part of your routine. And, like, again, like advocacy looks like taking care of yourself in that way. And so, like be in tune with your body. And again, that goes for any walk of life, right? Because
Right.
that's what the numbers are telling us. So like do those self
Yeah.
exams and make it your routine to do it. Doesn't take that long. And like Dr. Candace is actually telling me a different percentage, which is important to note. So definitely share.
Yeah, so it's 40% of abnormalities are found on palpation alone.
Got it.
Um,
Okay.
And I'll take the 40, right? Like
it's
do
still a
Right.
self,
high number. It's still pretty
right?
high.
Or just like again, like the like I just know some women who found it, right? And had they not been doing their self exams, they wouldn't have. And that is so powerful. So
Right.
even again, if you're not finding a safe space yet, with doctors and that thing, like start there, you know?
And how do
I
you do
agree.
it?
Yeah, no, so definitely go loveofmygirls.org. And again, girls, it's GURLS because you'll find a cute video of me in one of my Love of My Girls bonnets doing a self-exam. Yeah, and like just knowing that it's all about knowing your normal is really, really important, right? Just knowing your breast from month to month to like notice it. That way you would notice any changes if there were any,
Mhm.
because that's the mindset we want to have when we're doing self-exams. And yeah, go to the website and check it out so you can learn more. And yeah, I also love my girls Instagram, recently did a video there to do self exams, and again look for local advocacy for that as well. Because there's a lot of breast health knowledge being spread around right now, and I
Right.
feel it's really powerful. So just, even if it's just following a page or visiting a website, or, just getting in tune with it in some capacity to get the
Right.
process started. Those who are getting their annual mammograms and are also most likely to do their self exams, right? And vice versa, I believe as
Right.
well. So it's like just dive into your breast health in some capacity. And I think you'll find that you like want to know more, that you like want to be into it, and start the process. So, because age, it catches up like faster than
Right.
you think. Like I used to think that people like balded in like their 50s, and it's like balding starts in like a cute 28, like you know what I mean?
Right.
Like it's funny because it's like things just happen a lot faster than I thought they would in life. And so I think, the more that we can know that and be in tune with it is so important.
That's what I was saying too, is having an ally, since we're talking about pride and things like that, like having your advocacy ally, right? Like for myself, I'm like, hey, come with me to this, even though it might seem like just a small checkup. I loved doing that with my grandma. She'd always say she needs a fresh set of ears. I am almost 40 and I still need a fresh set of ears. So I think just having somebody there kind of almost to hold your hand, but then now they're also going to be getting that knowledge. And if you can have them in the room with you, like I'm like, oh no, they're good to come with me into the room in case they hear something, especially if you're going for something that might be scary. I know I'm not gonna retain as much information if I'm a little uncomfortable, you know? So if you don't have a doctor that you're comfortable with, if you don't feel like you can talk to somebody, talk to your friends, I mean, I'll call Haley and be like, girl, what's going on with this and the third? Or how do you do, just like you said, how do you do your exam? And now it's like, here's a video. I could show you better than I could tell you. So I think really just like we are supporting everybody in the community with whatever it is that they're experiencing. I think that's a really, really good way for us is just people of the universe to share and give. So that's my advice. And like I said, I do it. I'm going to do it for the rest of my life because I just think I learned that doing it with my grandma. I'm like, I do it with my friends. So I'm like, oh, you're gonna go get your teeth done? Can I come? We can turn it into a day, So just in case, but it also keeps us top of mind too to be like, you know what, it's my turn. You want to come with me next time? We got to go it's my turn, So I think that's one way to really support everybody in that sense too.
I love that.
Yeah, I think it's important. I tell all of my patients, especially if they come in and they're by themselves and they just got diagnosed with cancer, I'm just like, you should bring someone with you. Like, first of all, you're going to be in shock and not remember anything that I say. Second of all,
Exactly.
like, you need support when you're going through something like this. And like, If also if you're going through like a transition, it's helpful to bring someone with you as well. Your advocate can always ask questions that you
Right.
forgot to ask, maybe you didn't even think of asking.
Yep.
It's helpful too to like have a list of questions that to come in with. So because when you get there, like I said, you may just be like in shock and not be able to say anything. So it's always helpful to bring someone with you for any kind of exam, like Whitney was saying. Like it's extremely important.
And I feel like even yesterday with when I was in there with my mom, like I FaceTime my sister, right? It's like we have
Mhm.
technology now. I was like, hey, doctor, you okay? So I'm talking to my sister as well, and that was fine, right? And so again, like use the resources we have in that way, because you might be in a space where you're not close to somebody that you want there. You might have just left home to go off to get a job or go to college or whatever, and therefore you're going to doctor by yourself for the first time. And so that's new, right? And so, like, again, include people in the ways that we can. That way you are in the know, because there were definitely moments, even like my mom, we found her breast cancer because we were doing our routine appointments together before going back to school, right? And so, like, it was really impactful that, like, we had that routine around getting checkups and things like that. So, yeah, no, I think allyship is a great topic for this moment, right? Because it goes into so many different facets of our life, and like being an ally and knowing what that means and showing up for the people you love, like, right? That's what it is, like, in any capacity. So definitely knowing who they are, having them, relying on them, even when it feels hard, because like it's hard to ask for help. I think in my whole family we struggle with that concept, and so I think that knowing that they're there is really important. And actually, it was with Nia at the conference in your session that you led that somebody said, in advocacy, you kind of got to know that it's like a relay race, and that if you're taking a break and drop the baton, somebody else is picking it up. And so, like, again, that concept has really stuck with me, around, again, asking for help, finding those people, finding your allies, and having people in your community and utilizing them. So utilize community, it's there. That's why you like built all these friendships and why you did all these things.
Creating your own family too. I think that's something with pride too, that sometimes your blood does not understand you and what you're going through. So you create your own family,
Mhm.
and that is okay.
That's true.
Yeah.
Yeah, it's interesting that that's like the flip side of pride is having too much, and therefore you're like the ego piece of pride, right? And so, like, that being, like, I love when words mean multiple things in that way, and you get to decide how you work with it, you know yeah, that's interesting.
So more of the story, go to Dr. Candace, call us for anything.
Totally.
We're your allies forever and
Yes.
ever and ever. FaceTime
Yes.
us, DM, go on Love of My Girls, we're always here for y'all.
Totally,
Always.
totally. Yeah, no, thank you guys for a great Pride Pink Table Talk. Thank you for my, little caveat and hearing what my family's going through. And again, this is not unique to my family. A lot of families are having multiple things happening at one time, right? And so just like know that uh people are here for you. Community is there, let's all rely on it, like use our communities that we've built. So yeah, this has been an amazing Pink Table Talk. Thank you guys so much. Also pretty last minute. So thank you guys again for coming together and making sure we could have this conversation. Any last thoughts?
I hope Ricky recovers well.
No, she is great, and like, definitely she just got her phone back. So I took it for the night.
Take
So
it.
yeah, so but that was good. But yeah, so now she's back at it a little bit, but we're gonna keep her. Oh yeah, here she is. She wants to say hi really quickly.
Hi, Mom.
Yeah,
Oh, you should be in bed.
I know. Hi, Mom.
right.
Go lay down. We love you.
Oh, you look great.
I'm good.
hanging in here.
Yes, she's
Happy
currently
birthday.
screwing back in her earrings
No, no.
after surgery.
Happy birthday, Mama Ricky.
Thank you. Thank you.
You,
Yeah, it was a
if
rough
you
day,
needed
but
a
thank
spa, if you needed a spa day for your birthday, we could have skipped the hospital and we could have
Right,
went to
right.
the
you. Well,
spa.
at one point, there was like one black nurse in there. I'm like, are you guys not helping me out because I'm a black woman asking for pain meds?
That's so sad that
Right.
you went through all that. I know
Yeah.
you're
I
gonna get
know.
you're gonna talk to the VP, CEO, and all that. That wasn't
Yeah.
okay.
Yeah,
Yeah.
we're just glad that you're here, you're healthy, and you're back at it. And look, she's not even 24 hours. She's
I know. Look at her.
right
Right.
here.
No, totally.
I know, but I
Yeah.
can't paddleboard for a month. Oh my God.
Yeah.
Oh,
The
no.
hardest part is like no submersion in
No,
water.
no
So,
water.
yeah.
Yeah. Don't need any the girl, my friend got what is it, staph from her wetsuit.
Oh
Just
my gosh.
rubbing. Yeah. So
Wow.
he,
Well, this is pretty amazing. If I could show you, I have 3 little holes put together with glue.
Yeah.
oh, wow.
Right? The stitches
Yeah.
are on the inside.
No,
Isn't that wild? I
that's
know, not
good.
medicine, right?
Yeah. No,
Yeah.
it's crazy.
I had
But
a hole in my appendix.
Yeah.
Wow.
yeah.
Sorry,
No.
Well,
Mom.
good thing you didn't
Glad you're
rupture.
here. Yeah.
All right.
Yeah.
Yeah. Okay.
We love you.
Great pink
Thank you,
table
thank
talk,
you.
guys. Thank you guys so much for also like being family. I love these
Yes.
conversations. And another pink table talk down. We'll see you guys next month at the end of July for actually like
We'll probably film
some
early.
products about what?
We'll film early because your birthday.
Oh yeah, it is my birthday. You're right. So anyways, we'll talk more about that later. And then the next month is your birthday. So
When's
tune
Dr.
in
Candace's
though. We'll
birthday?
be here.
I know your birthday. When's Dr. Candace's birthday?
August 31st.
Mine's August 26th. Let's go. Anyway.
Oh, nice. Nice.
When's yours,
Virgo.
Whitney?
Wait.
September 11th. So we're just gonna keep it going.
Oh, we're
Yeah.
all Virgos.
We're all Virgos.
I actually have so many Virgo friends. It's
the
unreal.
best.
That's
She's
amazing.
You're so blessed, girl. Look at
Right?
you.
Yes, you
I feel
are.
that. Okay. Love you guys.
Love y'all.
Love you guys.
Love you.
Happy
Bye.
Pride.
Happy
You
Pride.
pride.
Bye.